So I want to start off by saying good morning to everyone, and again, thank you to all the first responders that are out there every day, to all the essential employees that are out there every day, continuing to keep government moving forward, to keeping our community safe, to the men and women of the police departments and sheriff's departments. Thank you for everything that you're doing. And to our great Department of Health, to all the people down there working day in and day out, and Dr. Whalen, thank you for your leadership down there. And to the governor's office, thank you. Unfortunately, since last night, we had 2 more people pass away. We had 2 more deaths. We had a male in his 60s last night and a male in his 60s this morning, both with underlying health issues, but nonetheless, 2 more. That gives us a total of 4, and my heart, my condolences, sympathy go out to the family, to their families, and we're praying for them, all 4 families. And so what I said back starting in March 12th, when we talked about everything, was that this was coming, and we're not even at the tip of the spear. We're going to see, unfortunately, more of this in the next week to 2 weeks, when this really starts to hit home more and more here in Albany County. And that's why I continue to say that message about social distancing, staying home and not going out, and especially seniors over 60 and anyone. I don't, anyone with underlying health issues, please stay home. Stay home for your own good. If you have respiratory problems, if you have any underlying issues, immune system that's weak, asthma, please stay home. That's all I can say to you. It's not easy when you get that phone call and you have to hear that we lost another resident of our great county. It's a phone call I don't like taking. It's a phone call I don't want to take. But it's the reality of the world we're in, and that's why I keep telling everyone, things are changing. Things have changed. But you need to take a step back, a deep breath, and realize things have changed around you, and we have to act accordingly to the things that are going on. With the COVID-19 continuing on, this coronavirus continuing and everything else, we need to address these issues at hand and make sure that we're protecting our loved ones and protecting people around us. With the 2 more people that passed away, unfortunately, and with limited testing, and I'll get into that in a minute, but we are at 254 confirmed cases now of COVID-19, the coronavirus. We went up 16 since yesterday. The county with 412 people under mandatory quarantine, 123 people under precautionary quarantine. And like I said yesterday, we had 238 positive cases. And you can see how the numbers change, because we have 412 now, we had 401 yesterday, and 202 people were under precautionary, and now we're down to 123. That number's going to change. But the other number that has changed, there are now 56 people being hospitalized, with a rate of about 11.8% of those who have been tested positive, 11.8% that are hospitalized. 15 adults in ICU, there was 12 yesterday, there's 15 today. The coronavirus is here, people, and I don't know how many times I gotta sound like a broken record and continue to tell people we have to change our ways. Another thing I have to put out there is that one of the workers at Popeye's Chicken restaurant at 90 Central Avenue in Albany came back positive, and we're asking people that visited or picked up food, shouldn't have been in there, but if picked up food, it was the cashier, that if you were in there and you interacted at the cashier register on Monday, March 23rd, from 4 to 10 p.m., And March 25th, from 11:30 a.m. to 4 p.m., please contact the Department of Health, because they're doing their job trying to track and map everyone that came in there. And if you're in that establishment on the 23rd and 25th, please, by all means, reach out so we can properly address the issue. I can't overstate how important it is for isolation, self-distancing, and making sure you continue to clean your hands every chance you get, especially if you're handling money. And to make sure after you handle that money or your credit card, wipe off your credit card and then clean your hands before you put the credit card back in your wallet. Clean everything off. Be smart. Been hearing more and more from the CDC about talking about wearing masks out in public. We're waiting to see what they're going to say, what the guidelines are going to be. But I want to say to everyone, please, we've been short on PPE, and it's a thing that Liza and I have talked about time and time again, about making sure we get enough PPE out to the people that need it, the first responders, the people that have to go out and do certain things, the people that work in group homes. So I don't want to, it's hard enough to get the supply that we need, but please pay attention. The CDC is probably going to change the guidelines on people being out wearing masks. But the jury's out on that. So it depends on who you're talking to. I'm encouraging all the knitting groups that are out there throughout Albany County, throughout the Capital District, to all our knitters and your little clubs, please help us with PPE. Make these masks. If you're there, if you can get your grandchildren to help out, keeping that social distance from everyone, please take the time. Even if you do 10 a day, you do 5 a day, it's going to make the difference in someone's life that's actually trying to take care of people in this situation that we have going on in this epidemic. So please, by all means, the sewing crews out there, help us out. I'm pleading to you. And I actually was joking around with my mother-in-law last night because she's a sewer, and I said, hey, while you're sitting there, because you're not supposed to be going out, you can sew away and make masks for everyone. And I go, especially for your birthday tomorrow, you can make us, I don't want to say how old she is, 71 masks to celebrate your birthday and get it done. It's going to help. And the one thing I take pride in this county is the people and the workers, but all the businesses that are really trying to make a difference and help us the best that they can. And Ford Motor Company has delivered the face shields. They delivered over 4,000 so far to St. Peter's Hospital in Albany Memorial, and I believe they got 1,500 more coming. So again, thank you, Ford, for everything that you're doing. Can't appreciate you enough. I had a great conversation last night with Anthony Frasina from Local 190, who is not only going to start putting their truck out there to warn people, to put it at different intersections about social distancing and everything else, but has offered, they already did a great donation in PPE. They got it to the Sheriff Apple, and they're going to be donating more PPE and actually want to help establish a fund to help first responders and different people out there in the community doing something. So to Local 190 and to Anthony Frasina, thank you for everything that you're doing. It's things like that that actually lift you up every day. We've been, to my staff and everyone that's been going around the clock, nonstop, very little sleep, no time off. I can't thank them enough. And when you deal with residents that are doing the right thing and people are doing the stuff that they should be doing, thank you. But unfortunately, we have the people that don't. And sometimes you got to punish the mass for the few that aren't paying attention. And it's the few that aren't getting this. And if this fourth death doesn't wake you up, I don't know what is. And what count do we have to get to you finally say, wow, this is real. This is happening. Maybe I shouldn't be hanging out on the street corner. Maybe I shouldn't be going out and playing basketball or playing soccer with a bunch of people. Maybe I should social distance. Maybe I should just stay home. Stay home. Life is about 10% what happens to us and 90% how we react to it. So keep that in mind. So this 10% that's being thrown at us, think about the 90% how you're going to react to it. So I'm asking everyone to stay home. You know, I don't want to sit here and talk about curfews and talk about passing things to keep people in their house. You should do it. We're adults. We're adults. And like I said before, when you come out of this, and it's going to be a while before we come out of this, you're going to look at life differently and have a different appreciation of what's around you. Things that you took for granted every day of your life walking down the street, you're going to look at it differently. And you're going to appreciate that corner store, that person that says hello to you every morning, or where you go get your cup of coffee. You're going to appreciate things differently. So look forward to that while you're sitting home. Write a book. Everyone has a good book in them. Sit home and write a book. Find a new hobby. Preoccupy yourself, but stay home, please, please. Again, I do want to thank everyone, all the residents of this county that have been doing a great job in paying attention, and to everyone helping out. Thank you so much for all that. But Dr. Whalen, you.
Thank you. So as County Executive McCoy said, we continue to see cases rise in Albany County. We are seeing that some of these cases are affecting our particularly vulnerable residents, and I wanted to speak a little bit about that. We are very aware of a critical shortage of PPE, and this is a real thing in the community, and specifically in situations where people are being cared for in their homes, people that are vulnerable, that would be under the consideration of likely to develop complications of COVID-19. We really need to think of a way to continue to protect these individuals. We talk a lot about social distancing. We talk a lot about staying home. We talk a lot about hand hygiene. This is important for the general public, but if you're caring for an individual who is vulnerable, it's 100 times more important for you. Your interactions in the public can, if you are a healthy young person, cause you to be an asymptomatic spreader of COVID-19. And if you interact with someone who's vulnerable, this can affect them in a very serious manner. In these situations, hand hygiene is essential. The considerations around PPE and masking are something that all of healthcare is discussing. The discussion around homemade masks, there was a guidance issued this morning, overnight, by the New York State Department of Health for healthcare workers. And they are saying that homemade masks are not recommended for healthcare workers. So why is this? From a health department perspective, from a medical perspective, from a scientific perspective, our recommendations have to be evidence-based. So we have to have evidence that something works before we say we support or urge you to use a certain strategy. Unfortunately, these masks have not been tested, and so we cannot say with certainty that they protect the wearer from respiratory droplets. And we cannot say for certainty that the wearer is not protected from spreading COVID-19. Therefore, it is unlikely that there will be a recommendation issued for healthcare workers to wear these masks. However, we are in an unprecedented situation. We are in unprecedented times. And this calls upon us to look at this from a practical perspective as well. We know that right now, the PPE that is available is being given to the healthcare workers that desperately need it. The PPE for individuals who are caring for COVID patients is adequate at the time. And this is good, because this is where it's needed most. And there are considerations at the EOC as these supplies become available of prioritization. And the prioritization for the PPE is, I believe, a good prioritization. But this leaves a lot of people in the general public with an uncertainty about what to do and how to behave. And the question of whether wearing masks might offer any protection. I cannot speak about this from a scientific perspective. But what I can say, and what I have said, is that if you are wearing any kind of barrier on your face, it is less likely that you will touch your face and not know you're touching your face. It is likely that if you're wearing some sort of protection on your face, that being aware of when you touch your face, you'll become more aware of how often it's necessary to wash and clean your hands. So from a practical perspective, there may be some merit. We have many people that are interested in having this practical application. And so, as the county executive said, we encourage people to continue to make these masks, and we will collect them at the health department, and we will provide them in situations where we believe that people may need them and have no other alternative. We continue to work very carefully to make sure that the supplies for PPE for healthcare workers are addressed. This is not about healthcare workers necessarily, but there are situations where people are working with vulnerable people where they simply do not have access to any PPE. And in the absence of being able to offer them what we know is scientifically proven, I feel it incumbent, and this is something that I am deciding personally, it's not based on guidance, that we need to offer something. So we will take those donations, and we appreciate them.
Thank you, Dr. Whalen. Listen, one of the things we've been fighting for, and I can't thank Luke Rogers and Dan Lynch, Chris Quinn, Mike McLaughlin, who've been working, Jeff Jameson, who've been working around the clock for the last week or so to get testing up and going. You know, we've talked to the two CEOs of Albany Med and St. Peter's and other hospitals, private companies out there, to the governor's office, and I'm hoping very shortly we'll have a great announcement for everyone here in this, in Albany County, what direction we're in. But I want to thank them people because it's been something that we've been doing around the clock. We need to get testing back up and running. We need to find out the mapping and tracking of this. So again, to the governor's office, I commend the governor and his people what they're doing, and to my staff, thank you to everyone involved with this. And if I miss somebody, I'm sorry. It's something that I know is important to the people. I have talked to my counterpart, Steve McLaughlin, in Rensselaer County. He feels the same way. We've had great dialogue going back and forth with great ideas between both counties, and the chair of the Schenectady County Legislature, Jasinski, about the same thing about Schenectady, working together for the people. And that's what it's about right now. This is all about us working in partnerships to make sure that we continue to get good stuff out there, but most importantly, working together for everyone in the Capital District. Unfortunately too, this hit a friend of mine that I grew up with and went to school with. My heart goes out to him and his family, to his nephew, and I don't want to say his name right now, but it's hitting everyone, and it's going to be surreal for a lot of people. And that brings me to the reason why I have Dr. Giordano here again to talk about the new norm. Not to panic, not to worry about if you got the dry cough or you get a little bit of a fever, about being scared. There's nothing wrong with that, admitting people that we're scared. There's nothing wrong with that. It doesn't make you less of a person, because if you're not scared, then I have an issue with you. You should be calling the doctor if you're not scared, because if you realize what's going on around you, things change, and you should be scared, and the parents should be talking to their children to make sure that they understand what's going on. So, Dr. G, please.
Good morning. Thank you very much. County Executive, you've got that exactly right. We're all in this, and we're all in this together. We wanted to take another opportunity this morning to remind you of the importance of paying attention to your mental health and your emotional well-being. Things are moving very fast. The last time I was here, I talked with you about living with chronic uncertainty and living with isolation. Those are both very difficult to deal with separately. Now we're dealing with it together. But now we're dealing with loss on top of that. And it's a loss of control, the loss of our identities, people who are out of work, whose sense of purpose in life has been suspended. And now today, and we've learned that we're dealing with even more personal loss of life. This takes a toll, obviously, and we know that there's a traumatization to this that we're all being affected by. There's no quick fix. I have no magic pill. Actually, I don't even give pills. But there are ways that we can manage our lives when we're feeling that things are out of control. And I mentioned this to you last time, and as the county executive said, feeling afraid, worried, anxious in an abnormal situation like this is normal. And so when we talk about taking control of the things we can, it's clearly our health and the behaviors associated with keeping ourselves healthy that you've heard over and over again. But every one of you can do these things. The feelings are difficult. If you can't hold your breath through this, though. You've heard people say this is a marathon, not a sprint. Most of us are not great at dealing with feelings to begin with, but I would urge you to try to acknowledge what you're feeling, share what you're thinking and feeling with others. There's great benefit in that. We talk about social isolation. It's really physical isolation, right? But we can remain socially connected, and that's very important. And I encourage you to do that. Taking care of the basics, you've heard over and over again. This is time, more importantly than ever, to take care of your sleeping patterns, your eating patterns. There's a lot of time now to do exercise. We were laughing the other day. People always say that, I don't have time to work out. Everyone does now, and it's critically important. I would end with just a couple of things, though, reminders. Pacing yourself with your exposure to the media, with all due respect, again, to the great job that the media is doing. There are some channels that are running the death toll like the stock market numbers. You can't watch that all day long. And I urge you not to. I've been accused of being a news junkie. I can't turn the news off. I got to tell you something. I'm turning the news off. You have to take care of yourself. You have to pace yourself. And as I said last time, there are so many self-help opportunities out there, not least of which is meditation and other kind of techniques that you go online. We're going to put some videos up that will help you with that. And if I could close with one of my favorite quotes from a great New Yorker from decades ago, Franklin Delano Roosevelt. He said, "Courage is not the absence of fear. It's discovering that there's something more important than fear." Fear is all around us now. What this tells me is that we have to act despite fear. We have to go on despite fear. Fear is not a sign of weakness, and it's not a sign of mental health problems. It's actually a normal reaction, but we have to go on. And as I said last time, how we treat each other and how we care for ourselves will define us at the end of the day in this. So appreciate the opportunity to say that again.